This is for anyone, maybe Superintendent, you kind of just spoke to this. Is there any concern this time around with February break, students returning for any outbreaks? I know that's happened in the past when students return from summer break or spring break as well.
I didn't hear you clear. Can you ask the question again?
Yeah, sorry about that. So with February break, is there any concern with any outbreaks in terms of COVID transmission with students coming back to school? I know that's been an issue in the past, with students coming back from spring break or summer break.
We can't predict what's going to happen. However, what we can do and what we have control of is making sure that we do everything within our power to make sure that when students return to school, that everyone is safe.
So can I just add to that? That's why at-home tests were sent, right? So that parents can make that decision. You take the test. Remember, we've been hearing that it's about personal responsibility. So that's what we are going to continue to talk about, this personal responsibility. So in all cases, get tested. The superintendent sent out the tests. Take them. Take them before you come back to school.
So I don't know who this is for, but everyone has talked about having metrics to determine and guide policy. What is the metric that is determining when the mask mandate in the Providence public schools will lift?
So I think any of us can answer that. We're looking into that. We're working very closely with RIDO to determine that. Right now, we're focusing in on the vaccines. And anyone, as we said, that has lower than 20%, that's where we're going to target. We're being very strategic about where we have the vaccines, what we do the work. It's an ongoing process. What we've learned with this pandemic is that we have to be flexible. That's the key word here, flexibility, and we're going to keep looking at the numbers and the data, and we're going to keep working. 150 were done last week. We'll see how many get done this week, and we'll continue, and then we'll make decisions accordingly.
And then one follow-up, this is for Dr. McDonald, not on schools, but vaccination numbers overall. As the governor said, the current numbers are that 99%, essentially all adults, have gotten at least one shot. But very less than half have gotten a booster, and there's a huge number, I think 15% or so, who haven't even gotten a second shot. Are those numbers credible? Are you confident in those numbers, or is it possible that boosters and second doses are being reported as first shots?
Yeah, so here's the numbers I keep in my mind, and just by the way, it's like you need a program guide for the numbers every day here, right? But 38% have been boosted in the state. So that's a 38%. That means they're up to date with the vaccine. 80% have completed the primary series. That's good, but 99% have had one shot. I really think it speaks to a larger point, though. It's funny. I learned this in the Navy. The Navy told me they would never lie to me, but the truth would change. All right? I rolled with it. In the Navy, you do these things, right? So if you got, the message that, gosh, I need to get 2 vaccines, I'm done forever, that's just the way science is. We get new information. You need to be up to date. In other words, science changed. The virus mutated. So 2 doses isn't enough. We need people to get 3 doses. When I look at what we can do for our people in Rhode Island to protect us for the fall coming up and for next year, the best thing I have for you is the booster vaccine. I got to get as many people as possible up to date. And to the question earlier about what's the metric for schools, it's really about minimizing risk. Really, it's about as many kids as possible as vaccinated and getting decreased case counts in the community. The more people are vaccinated, the less cases you get. And it really is one of those things where we have treatment for it too, but the treatment's really for 12 and older. That 5 to 11 crowd, I don't really have a great treatment for you. I have the vaccine for you. I hope that helps.
Quote of the year there from Dr. McDonald as well. The question's actually for the commissioner. In an op-ed this morning in the Providence Journal, the chair of the Barrington English Department, Kevin Blanchard, says that there's an inequity at play because teachers in his district are being required to be vaccinated and boosted while students are not. Do you see that as an inequity, and do you sense that at any time there'll be a Department of Education policy requiring all students be vaccinated to the fullest extent possible at any time in the foreseeable future?
I don't know if I would call it an inequity. I think that adults make the decision, and locally in Barrington, they have been really aggressive about it. In terms of vaccinations for school-age children, RIDE doesn't make decisions on vaccination. We're working with the Department of Health. I don't think that that's something that we're ready to be there. We're going to continue to work on the vaccination clinics and continue to push. And Barrington has done a great job. Barrington's at about 79%. And I'm sure that the ones that they're still working on the rest of the numbers that they need. But we're not there yet. We're still trying to figure out what localized approaches will look like.
And just very quickly, you mentioned more success in East Greenwich or just now Barrington than certainly Providence or this building we're at right now. What's your gut on the main cause for that?
My gut, and it could only be my gut, right? Because I don't have all the information, is, there's these communities that have lower numbers have been personally impacted in a way that other communities have not. So there's a lot of fear, there's a lot of, concern. A lot of the students in our schools have lost parents, are now living with other relatives. So there's a lot of uncertainty, fear, mistrust, all the things that we think about. And what we need to do is do a better job of communicating how safe the vaccines are, and they need to hear from people they trust, pediatricians, local communities. As much as I hate being thought of as a bureaucrat, I am one, right? You have to hear from the people that you trust. Who are those people? Who do you trust? That's who the community needs to hear from.
My question's for the governor. This is on a slightly separate topic. This is regarding the $3,000 retention bonuses. Okay. Okay. Thank you.
Thank you. Dr. McDonald, this is for you. There are talks that there could be a potential 4th dose of the COVID-19 vaccine. Is the state able to support that? And do you think, to Bill's point, that the vaccine will become a regular shot, like the flu shot, for example, for students and others?
Yeah, so, really you're asking, do we foresee a periodic booster like a flu vaccine? I think that depends on how many more variants we see. So really what I see is this: if we see new variants that aren't covered very well by the vaccine, then you're going to see a periodic booster, and that's possible. That's what our future might hold. Your other question was about what Bill was asking about schools.
It will become a regular vaccination requirement like the flu shot is for students to go to class and school.
Yeah, so it's specifically just that we are not looking right now at making this a vaccine requirement at the Department of Health. Just for a little timing perspective, the vaccine for 5 to 11-year-olds became available on November 5th. That really isn't that long ago. So I think parents need to have some time to get used to this idea, ask the questions. Really, I think one of the things Commissioner Infante Green just said, which is really powerful, is if you really think about why people aren't getting the vaccine, you really ask the main reason. We have a trust problem. And the trust problem is not something I can fix with one press conference, my friends. This is a historic issue in our culture. We have a trust problem. And it's really about building trust. And I think to some degree, what you look at the efforts that we're doing right now, it's about we want to build as much trust as possible and be worthy of that trust. We do that, I think the vaccine rates will get better. So we'll have to wait and see what we do here.
Well, this is simple. The Department of Health and you guys have to do a better job. And I'll give you an idea. Meet with every radio station on it in the state of Rhode Island that speaks Spanish, because it's not trust in the commercial that you're putting out in English and in Spanish. You need to use real community leaders. Not because somebody have a name, it's going to penetrate to the community. You guys are sending the wrong message. You need to change that voice in English and in Spanish. You got a lot of community leaders that can do the message. You got school superintendent. You got directors of school. Use them, and you will see how we change. Now, who is responsible to make that change, that decision? The governor or the Department of Health? Because you need to change the strategy. If you really want this to work in the Latino community. Who's responsible for that change?
Thank you for the suggestion. I love your idea. I agree with you. I'm going to employ as many trusted voices as I can. Couldn't agree with you more, by the way. I completely agree with you. People want to hear from people they know. I'm happy to help. I'm sure the governor would be happy to help too.
Doctor, how do you shift from a strategic standpoint from pandemic to endemic? What will change? I assume you're looking ahead to this change. What can we expect in terms of a change?
Yeah, so when we use the word pandemic, that speaks to basically a global epidemic, and that's what we've been living with the last 2 years. By the way, Monday is the 2nd-year anniversary of patient number 1 in our state. When we move to endemic, we're talking about living with this. We are working on an endemic plan at the Department of Health. What an endemic plan means, like, what are metrics we can use, mostly based on hospitalizations that we need to say, maybe we need to scale up. And when I think about scaling up in the future, I think more about recommendations from us at the Department of Health about what are some tips we're going to give you. Like, one of the things that's common in other cultures, like when I was in the Navy, I was stationed in Japan for 2 years. It was very common for people to wear masks in Japan. During the winter, for example, if someone had a cold, they always wore a mask. But what you can expect is our messaging can be tailored to the prevalence of cases and the impact on our hospitals. But the impact on our hospitals is going to be the most important metric. The case counts is a secondary metric. We'll use that as well. You're still going to see isolation. In other words, if you're sick, we're still going to say you shouldn't be going to work. By the way, it was never okay to go to work sick. I know we did that as Americans. We're rugged individuals. We go to work sick. That was always a bad idea in the first place. Quarantine will move to a recommendation. You know, at some point we'll just tell you, here's what you should do. You know what I mean? But when you look at our endemic plan, one of the things that we really are going to focus on too is, by the way, it wouldn't hurt us to get a little bit healthier. One of the reasons why we as Americans had such a hard time with this pandemic is we're obese. We have too much diabetes. We have too much hypertension. We have too much preventable chronic diseases. Now, me telling you to lose weight doesn't help, but me working with everyone in government and with my community about improving social determinants of health. This matters, right? So part of an endemic plan means I want to make sure you have good schools to go to. I want to make sure you have safe neighborhoods to live in. I want to make sure you have jobs that are reasonable. I want to make sure you have a safe life a little bit. And that really gets to the larger message of public health. Like when you think about the health department, you must think like, do we go to bed every night worrying about everybody in the state? Turns out we do. There's a lot of reason to worry about you guys, you know what I mean? And so there's a lot of things that we try to do to improve your lives every day. You know, for some people, you just discovered the health department 2 years ago. We've been here for over 100 years. We're going to be here for another 100. But we're going to be working on things that we've always done, like social determinants of health. So you just don't stay healthy. You stay healthy. Because here's what I need to do. If I can get you to lose weight, lose your diabetes, lose your hypertension, if you get COVID, I can keep you out of the hospital. Because when I look at who ends up in the hospital, the high-risk individuals have these adverse health conditions. I got to do what I can. I can't prevent every chronic condition. I can't prevent every cancer. I can prevent some. I'm going to do what I can to prevent most.
Do health equity zones play a role in that, or do you anticipate
Health equity zones
changes?
are really important to us. They're synonymous with the Department of Health. And health equity zones, just so people know, not everybody knows what a health equity zone is, but we have regions in the state that just, it's like customized public health to your neighborhood. What a health equity zone really is personalized and customized public health to your neighborhood, working on the social determinants of health that matter in your neighborhood. That's really what a health equity zone is, and they do great work for us. Thank you.
Dr. McDonald, if you could join me again. This question is regarding, if you will, COVID conditions affecting the incarcerated Rhode Islanders here. Number one, and by the way, there are serious allegations about terrible conditions in the ACI and the Wyatt. Number one, do prisoners have the option to receive a booster? What is the availability of masks? What are vaccination rates at the Wyatt and the ACI? And when and where was the last, if you will, health inspection, health audit at either of these organizations, and where was it documented?
Yeah, so there's certainly plenty of vaccine available for anybody who's incarcerated in the state. There's plenty of masks available as well. We don't routinely inspect the Adult Correctional Institute nor the federal prison for things like that. So I couldn't tell you when that was done. I'm sorry, I don't know that information.